Hi everyone, I am Dr. Radhika, Senior Gynecologist, Obstetrician and Laparoscopic Surgeon. Today I wanted to discuss with you all about the fibroids. So what are these fibroids? The fibroids are usually the tumors in the uterus. Mostly they are confined to the uterus. Sometimes they can also come in the tissues adjacent to the uterus also. So we call fibroids as leiomyoma, means it is the muscle thickening. Usually they are benign, that means they are non-cancerous lesions. But very rarely, especially in the old age, in the post-menopause, they can be cancerous. That we call them as a leiomyosarcoma. But the chances of leiomyosarcoma is very less than 1% of cases. So what are the problems with the fibroids? Do you have to really worry whenever you are having fibroids? All these things we will discuss today. So the fibroids, usually they come according to the position where they are in the uterus. There are three types. So if suppose this is the uterus. In the uterus, this is known as outer layer. This is the muscle layer. This is the inner layer. So, if fibroids are only present on outside of uterus, we call them as a subserosal fibroid. And if the fibroids are present in the muscle, they are known as intramural fibroids. And if the fibroids are present inside of the uterus, inside, and they are pushing the cavity or they are inside the cavity, then we call them as the submucosal fibroids. So, there are three types of fibroids. One is the subserosal, second one is the intramural, third one is the submucosal fibroids. So among these three, especially the intramural and submucosal fibroids, these cause most of the symptoms, most of the problems to the patient. What are the problems with which fibroids will come? Heavy bleeding, they can cause pain during periods, they can cause pain and the bleeding in between the cycles. And depending upon the position of fibroids, they can also cause infertility. If suppose a fibroid is present at the tubal, near the tubal opening, it can cause the infertility. Or if suppose a fibroid is protruding into the cavity, submucosal fibroid, it also prevents the embryo to implant in the uterus. So, or a fibroid present near the cervix can also cause infertility. So there are some types of fibroids or some positions where they can cause infertility. But all fibroids will not cause infertility. So mostly the symptoms will be heavy bleeding and pain, and sometimes they can also present to us with the mass per abdomen. So what are the treatments of fibroids? Usually the medical management is limited only for the very small size of fibroids. We will give the medications, and there are some side effects to the medications also. So we carefully choose the cases where we have to give medication. Other interventions like uterine artery embolization, they can also be tried. And today we will especially speak about the surgical interventions. So, if suppose a woman has 2 centimeters fibroid and she has no symptoms, does she have to go for surgery? No. If asymptomatic fibroids, small size fibroids are there is no need to go for surgery. But they have to be under follow-up, and they have to do scans regularly and see whether the fibroid is increasing in size or not, or whether if the woman is getting any symptoms. The indications for surgery are the fibroid size more than 5 centimeters, or if the uterus size is 12 to 14 weeks, that is corresponding to the 3 to 4 months of pregnancy. If they are there, then also we go for surgery. And main important thing is, irrespective of the size, where the fibroids are situated. Even if the small fibroids are situated nearer to the cavity, that is submucosal fibroids, even if they are small, 2 centimeter, 1 centimeter, they have to be removed because they cause lot of symptoms and they also cause infertility. And they will not respond to any medications. So, grossly, I am telling the indications for surgery are the size of fibroids, number of fibroids and location of fibroids, and what are all the symptoms it is causing, and it is hampering the fertility or not. Coming to the surgeries which we go for the fibroids, mainly are two types, whether removal of fibroids or in elderly age group when more fibroids are there, and when woman does not want fertility, sometimes we remove the uterus also. So there are mainly two options, the myomectomy or the hysterectomy. Coming to the myomectomy, if suppose small submucosal fibroids which are into the cavity will be done by the hysteroscopic route, that is hysteroscopic myomectomy. But if the fibroids are in the muscle or in the submucosal fibroids or a submucosal fibroid of more than 3 centimeters of size, then we are going for laparoscopic myomectomy. If multiple fibroids are there, if the size of uterus is very big, sometimes very rarely we go for open myomectomies. So what is this myomectomy? Myomectomy means it is the removal of fibroid. So we remove the fibroid and then we suture the uterine wall. So two important things before going for surgery is we have to know how many fibroids woman is having, where are they situated. That is known as mapping of fibroids. So before surgery we should have the estimation how many fibroids we have to remove and where are they. Then we'll proceed with the surgery. Expertise of surgery is very important while doing laparoscopic myomectomies. We have to do complete job, remove all fibroids, and very important thing is the suturing of the myoma bed or suturing of the fibroid bed. So this decides the strength of uterus later. One important point in laparoscopic myomectomy is whenever you underwent laparoscopic myomectomy, you have to wait at least 3 months before going for any fertility treatment, because you have to give time for the uterus to come to the normal or to suture well. Then after laparoscopic surgery, usually we have to do scans after 2 or 3 months after surgery and see if everything is good. In cases, if suppose a woman is more than 45 years and she is having multiple fibroids, sometimes we may go for directly hysterectomy, that is removal of uterus also. So these are all the options which are available for the fibroids. Thank you.